Coming up, the Tories' Health and Care Bill had its first reading in Parliament this week, and it's all looking pretty scary. It paves the way for the dismantling of the NHS as we know it, to be replaced by an American-style private insurance-based system, allowing plenty of opportunities for self-enrichment on behalf of all those companies donating and buddying up to the current appalling corrupt government. But before I start, if you approve of what I'm saying, I'd be very grateful if you'd subscribe and like, and that would help me. Sorry, I don't know what happened there. Maybe I've been watching too many of the fantastic Michael Lambert's videos. The Health and Care Bill is sponsored by Sajid Javid, our current Health Secretary, who's a devotee of the free market conservative writer Ayn Rand. The Donald Trump-endorsed Ayn Rand Institute believes that healthcare is not a right, which precisely sums up the current government's philosophy when it comes to our NHS. The Health and Care Bill is a piece of legislation that will lead to privatisation not just of the delivery of specific medical services, but of the very way that the NHS is administered and delivered, putting power in the hands of private sector companies when it comes to decisions on care delivery. People who are obliged by law to put the interests of their shareholders before the interests of NHS patients, or customers as they will soon be known. I have done quite a bit of research into this bill, but not as much, admittedly, as the 99% organisation, whose comprehensive fact pack I was lucky enough to be sent a copy of. It opens with a quote from former Prime Minister John Major, who says, "The concept that the Johnson government would care for the National Health Service is a rather odd one. Michael Gove wanted to privatise it, Boris wanted to charge people for using it, and Ian Duncan Smith wanted a social insurance system. The NHS is about as safe with them as a pet hamster would be with a hungry python." And that's from a former Tory Prime Minister. The 99% organisation share my concerns that this bill could sound the irreversible death knell of the NHS. The government have filled their boots during the pandemic with billions of pounds of public funds diverted to Tory-linked firms and individuals using so-called emergency measures that were used to avoid proper scrutiny and accountability in the awarding of non-competitive contracts. They've now got a taste for it, and this new bill is designed to remove the necessity for public tendering of privatised NHS services. Sounds like they found a way to extend the opportunities for more dodgy VIP lane contracts beyond the pandemic. More corruption, less accountability, and worst of all, we'd best expect a massive decline in the effectiveness of delivery and standards of patient care. I mean, you only have to look at the proportion of dodgy PPE from Tory donor companies that was either not delivered at all or had to be returned or destroyed because it turned out to be not fit for purpose. Do we really want to see the equivalent happening with critical patient care delivered by companies with a profit motive in place of a care motive? Because that's what this bill enables. In fact, it removes the statutory duty on the Health Secretary or on the new NHS boards to provide hospital care. You heard that right. The new NHS boards formed by this bill will have the right to withdraw patient services from you, your parents, your children, and you'll have no right to challenge that decision in a court of law. There are also new payments proposed by the bill that could lead to new categories of services having to be paid for. This is, of course, already happening under the Tories. My wife was shocked to be presented with a bill for an X-ray earlier this year following emergency treatment at Torbay NHS Hospital following a broken leg. So that promise about the NHS being free at the point of delivery is already no longer true. But it looks like it's going to get a hell of a lot worse. No wonder that the Byline Times have labelled this legislation the Privatization, Corruption and Service Withdrawal Bill. It also removes scrutiny and transparency over the awarding of NHS contracts, increasing the possibility of corruption, or at the very least, ineffective procurement. Even worse than that, the legislation makes the Health Secretary all-powerful, with new powers to abolish existing NHS management bodies and to reconfigure the NHS any way the Health Secretary damn well pleases. And with Sajid Javid, that will undoubtedly mean denationalising the NHS and selling it off to private medical providers, just like in the American model. And another thought. Some viewers may remember earlier this year when we all had to opt out of the scheme whereby NHS patient data was automatically available to be sold by the government to third-party companies. So many of us did in fact opt out that the government had to abandon that proposal. But under this new bill, we may not have the opportunity to opt out, as it puts control of this data fully under the control of ministers. What's so scary about this is that in the near future of a Tory Britain, when we're all being forced to take out health insurance, those insurance companies will have access to our patient data, so they can charge unaffordable premiums or completely refuse insurance cover to anyone with a pre-existing condition or a record of bad health. The 99% organisation say, "We are also concerned that some members of government are motivated to denationalise the NHS and or replace it with a US-style insurance system, leaving a basic service as a fallback for the poor and or uninsured, and that some of the bill's provisions may have been covertly drafted to enable that change." Why the Tories always use America as a model can only be on ideological grounds, because not just morally but economically it makes no sense. Take a look at this chart, which shows effectiveness, defined as life expectancy, plotted against efficiency, how much care provision costs per capita. You can see that the NHS is a mid-range performer, slightly worse on average among developed nations for effectiveness, but above average for efficiency, despite 11 years of Tory rule that has seen a lot of health expenditure go to private companies who skim off a sizable profit. Johnson's government are aspiring to have a health system like the USA, a poor performer both in effectiveness — American life expectancy is almost 3 years less than that in the UK, and in cost per head, which is 2.5 times higher in America than in the UK. As I say, what basis can there be to aspire to change from the UK to the USA health delivery model other than an ideological one? The NHS is pretty much based on a socialist model, which is why the Conservative Party fought its establishment for decades in the first place. And with a gullible and uninformed electorate distracted by the never-ending Brexit divisions, this worst of all Tory governments now see their opportunity to remove the socialist, free-to-all at the point of delivery NHS with a capitalist care system based on profit and restricted by the ability of the patient to pay. We've all seen how the privatised test and trace programme managed to funnel £37 billion of public money into private sector Tory donating trousers without delivering on any one of its objectives. Just imagine the size of the prize when this bill passes into law. And I'll just leave you with this quote from an article authored by, among others, Michael Gove, Jeremy Hunt, Kwasi Kwarteng, and Mr. Dido Harding John Penrose. Our ambition should be to break down the barriers between private and public provision, in effect denationalising the provision of healthcare in Britain. Apologies for this horror video today. I hope you managed to sleep tonight.